and health and safety report, resilience and accountability and health and safety reporting, and is submitted by Lothian Health. Call the mover now for motion 52.
Thank you very much. I'm a nurse, so I'm here to tell you the truth. Right, good afternoon, conference and chair. My name is Tamzyn MacFarlane. I'm here from Lothian Health Branch, and I'm here to move motion 52, which is strengthening climate resilience and accountability in health and safety reporting. I'm very proud to be moving one of the only climate change motions today. I stand before you today not just as a member, but as a research nurse and working within the NHS, a system built on evidence, safety and accountability. Every day we collect data, understand harm, we investigate incidents, we change practice based on what the evidence tells us. That is what makes our health service safe, but conference, there is a growing area of harm that we are not properly measuring, which is what Neil Cartwright very helpfully gave me lots of examples of just earlier. And that is the impact of climate change. We already see it in our workplaces, as Neil just demonstrated. We see it in overheated wards where patients and staff struggle in unsafe temperatures. We see it in disrupted services during extreme weather. We see it in rising emissions during heat waves and poor air quality. But we are not consistently recording these events. We are not capturing them in our safety systems, and because of that, we are not learning from them or adapting. In healthcare, if we don't measure something, it doesn't exist in the system. And if it doesn't exist, we don't fix it. Conference, international evidence, and evidence just shown today, shows us what is coming. During a sustained heat wave in Spain last year, there were a sharp increase in respiratory rate, emissions and cardiovascular events, and a very shocking rise in mortality, nearly 100% increase in that 6-day event. For the older age range, I should have said that. And yet, across the UK, our incidence reporting systems do not have a clear way to log climate-related harm. There is no consistent category, no standardised data, no national picture. At the same time, we know what the solutions are, and they do exist. If you look at the Green Theatre programme that's run from Scotland, there's several adaptation policies that you can take on board. Some health boards have already adopted those lower carbon anaesthetic gases, which is one of the first projects that the Green Theatre programme came out with. And some are adapting buildings and services to cope with extreme weather. But progress is inconsistent. And without data, there is no accountability. Mitigation could happen at a faster rate if we were consistent. Conference, this motion is not asking for something radical. It is asking us to do what the NHS already does best. Measure risk, learn from it, act on it. By introducing a dedicated climate and sustainability category into our safety and reporting systems, we can identify risks to patients and staff, plan services more effectively and protect our workforce, and accelerate the adaptation of proven solutions, such as the 11 categories that I've just said about the Green Theatres programme. Please take them back to your board. It is about turning climate change from an abstract concept into recorded evidence-based harm. And once we have the evidence, we can no longer ignore it. Conference, the climate emergency is a healthcare emergency, and if we are serious about patient safety, staff well-being and the future in our NHS, then we must start treating it like one. One of the areas of carbon data that is not fully captured or captured at all is the industrial military complex. And when Trump began his war of choice by bombing Iran, I used my visceral reaction to start creating a visual frame, this is this, which I now take on my yoga roadshows, which I go to each of the hospitals in my area, and I engage members to tell me what they're already doing to mitigate carbon, and I engage them to find out what's going on in their areas, and then I can help to make adaptations and changes to make staff well-being better and safer for patients. they also tell me what's happening on the ground. So we have had a recent hospital opened here with sick kids. It was only opened less than 5 years ago. But in high winds, our main entrance, the atrium, has to shut because of the design. And we also have had cladding falling off. They put those things back in at the same standards. They are not doing it to higher standards for climate. Conference, please, I urge you to support this motion. Thank you.